This episode is brought to you by Bumble. So, you want to find someone you're compatible with, specifically someone who's ready for a serious connection, totally open to having kids in the future, is a tall, rock-climbing Libra, and loves rom-coms with vegan pizzas on Tuesdays just as much as you do. Bumble knows that you know exactly what's right for you. So whatever it is you're looking for, Bumble's features can help you find it. Date now on Bumble.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by a guest bestie, Dr. Ashley Lerman, a board-certified pediatric dentist practicing in New York. Ashley educates people on social media on her page, Mommy Pediatric Dentist, and she also founded First Grin. This initiative increases access to evidence-based preventive information, distributes oral care kits via OBGYNs and pediatricians, and offers an educational app for parents, promoting early and effective oral health habits. It provides a digital dental trauma guide, as well as helps connecting people to dentists. All right, we're going to talk about pediatric dental issues. The clock is ticking, so let's get to it. Ashley, what are the most common dental problems in children, and how can they be identified early on?
So cavities are kids' number one chronic disease. They usually start between teeth or on the chewing surface of the teeth, emphasizing the importance of daily flossing and brushing all surfaces of the teeth. Keep an eye out for discoloration, stains, or holes on any tooth surface. Cavities usually start as a bright white line, then progress to brown or yellow cavitations. Cavities in the baby teeth are correlated with cavities in the adult teeth, so it's important that we set a healthy foundation from the start. Check with your dentist if you're concerned.
All right, so the million-dollar question, because this isn't always easy. How can parents establish good dental hygiene habits for their children early on?
So the key is to start early by incorporating it into a routine. Before bedtime, wipe teeth after your child's night feed. Don't sleep with a bottle of milk, and avoid eating after nighttime brushing. You can even start wiping the gums before there are any teeth. Help your kids brush until they can tie their shoes, and still always check their back teeth. They tend to miss them. Encourage routine dental checkups and lead by example.
All right, so what are the recommendations for a child's first dental visit and ongoing dental checkup schedule?
The first dental visit should be within 6 months of the first tooth appearing or by age 1, with routine checkups every 6 months. This proactive approach allows for early assessment and personalized preventive care. X-rays help us see between the teeth, which is a common spot for cavities that we miss just by looking in the mouth. The frequency of X-rays depends on risk factors.
All right, so how does diet and nutrition affect our child's dental health?
This is huge and often left out of the conversation. So frequency of snacking is correlated with getting cavities. So snacking on simple carbohydrate snacks like chips, puffs, cookies, which break down to sugars in the mouth, and sugary foods can lead to cavities. We want to encourage organized meals and offer water to drink afterwards to help flush the mouth. Avoid allowing food to sit in the grooves of the teeth for extended periods of time to prevent cavities by brushing and flossing.
So funny, just last night we did a family movie night in my house. And so my kids, they're a little bit older, they were eating popcorn. And I know that popcorn really gets in those nooks and crannies. So we paid extra careful attention to their teeth before bedtime.
I love it.
All right, so what emergency dental situations can occur with kids and how should they be handled?
So we see this all the time. Dental emergencies like trauma, bumping the face, falling off a bike, slipping in the tub are common in toddlers and sports-age children. As a parent or caregiver, you always want to stay calm, clean wounds if you need to, and contact a dentist. For teeth that are knocked out, never reinsert a baby tooth. You can risk damaging the adult tooth. For an adult tooth, reinsert the tooth into a socket and bite down on a little gauze, or if you're not comfortable doing that, store it in a cup of milk and seek immediate dental care. Time is crucial. Go to the ER if there are any signs of concussion or loss of consciousness or vomiting.
How interesting. All right. Well, I learned something. We hope you learned something, and we have lots more to share. Special thanks to Dr. Ashley Lerman for sharing her expertise. You can follow her at Mommy Pediatric Dentist on social media and check out First Grin for free evidence-based practical information for caregivers that promote early oral and dental health habits. You can get your bite of health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.